Thank you. Now, on opioids, there's an overwhelming consensus among addictions professionals, community organizations, and families with lived experience that the leading cause of opioid deaths in Canada is the tainted street drug supply. It's plainly obvious that ensuring a safe supply would save lives. No less a figure than the president of the Canadian Medical Association is calling on Canadian politicians to have a, quote, open and courageous debate, end quote, on decriminalization. Yet you and the Prime Minister have explicitly ruled out any consideration of decriminalization and regulation. So my question is this: do you disagree with the stakeholder consensus, or is it simply a lack of political courage?
Mr. Davies, I think that you've heard me probably on several occasions that I certainly recognize that the opioid crisis is a devastating situation that's happening in our country at this point in time. And we certainly have to use all tools at our disposal in order to turn the tide on this crisis. With respect to the issue of decriminalization, I believe that decriminalization alone is not going to provide a safe supply of drugs on the streets, and many other experts in the field have said the same. Having met with individuals in Portugal as well, they've indicated that decriminalization alone is not the silver bullet solution in order to effectively turn the tide on this crisis. What I do, however, feel is having a safe supply of drugs is an option and a step in the right direction. That's why that regulatory changes have been made to ensure that medication replacement therapy is available. And we have ensured that diacetylmorphine, for example, we've gotten rid of some of the red tape that needs to take place for doctors to be able to prescribe it, and also the medication of methadone. So we continue to work with partners on the ground. We continue to use all the levers at our disposal to make sure that we effectively deal with this situation. But once again, I certainly recognize that more work needs to be done in this area, and we will continue to make the investments and to provide the support and leadership as a federal government.
Okay. Well, thank you. So, Minister, I mean, you've repeatedly claimed that your government is doing everything possible. You just said it again, using every lever to deal with the opioid crisis, but of course that's not true. Besides ruling out decriminalization, which is one lever that obviously would result in much more safe supply of drugs being accessible to Canadians, you've refused to declare this a public health emergency under the Emergencies Act. We just heard this Tuesday, actually, from Sarah Blythe, who operates an overdose prevention site on Vancouver's downtown east side, the epicenter of the opioid crisis, that they received no federal money or a federal exemption to operate legally. And your government has failed to join BC's civil lawsuit against opioid manufacturers, just to name some. So we know that the U.S. federal government has secured criminal convictions and civil damages from opioid manufacturers for violating U.S. federal law. My question is simple. Has your ministry investigated criminal and civil violations of Canadian federal law? And if not, why not?
Well, you've asked 3 or 4 parts of your question there.
Just the last question is all I really want to know the answer to.
Well, with respect to addressing your question, though, with respect to declaring it a public health emergency, I just feel that I have to address that. If we felt that we had any more tools at our disposal by declaring this a public health emergency, we would absolutely do so. I've checked with my officials. I've checked with the Minister of Public Safety. By declaring it a public health emergency, it would give me no other levers to work with. And that is why that we haven't gone forward with declaring it a public health emergency. Again, with respect to decriminalization, Mr. Davies, decriminalization will not provide safe drugs on the streets to individuals. That alone is not going to be the end-all, fix-all. And with respect to the lawsuit in BC, as you've made reference to, our department is reviewing the class action or the lawsuit that's been filed by British Columbia, and no decision has been made at this time.
By the way, it's not just decriminalization, Minister, it's decriminalization and regulation of drugs to ensure that Canadians get a safe access to drugs.
Yeah.
But I want to move, if I can, to forced sterilization.